everyone, my name is Claire and welcome to USMDpedia. This is a channel meant for doctors that would like to work in the US. So today's video will be focusing on the process and steps in going to the hospital in the US. So this video will be helpful for you if you'd like to learn more about the US healthcare system, or if you're moving to the US and are not sure about what to do if you were to go to the hospital, or if you're a doctor and you're going to start working in a hospital and would like to know what to expect for your patients before they're in your care. So, I have a medical concern. What's the first step? In the US, it's common to call your primary care physician, or PCP, whenever you have a medical concern and set up an appointment with them. It's important to try and find a PCP as soon as you arrive in the US. This will help you avoid needing to go to the hospital in the first place. However, if you don't have a primary care physician and you have a medical concern, it's important to know where your options are in order to receive treatment and care. The first question you should ask yourself is this a medical emergency or an urgent medical problem? If you are having an urgent medical problem, walk-in clinics may be the better option for you instead of the hospital. Walk-in clinics can help you with medical problems that are not exactly an emergency, but also not something that you want to wait too long about either. So some of these can include urinary tract infections or UTIs, minor injuries such as a sprained wrist or ankle, or minor illnesses such as a severe sore throat. So these walk-in clinics, you don't need to make an appointment with them. You can just walk right in. And they will probably be a lot cheaper than going to the hospital. Let's watch a quick scenario.
La 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 la. Ow! Oh, something got in my eye. Oh, it really hurts. Well, I can open it, but it really hurts. Well, this isn't a medical emergency, so I'll skip the hospital, but ow, I really want to be seen right away, so I'll go to the walk-in clinic.
Well, what seems to be the problem?
Something's got in my eye.
Oh, I'm sorry. Let's take a look. Might be a little bit bright. Yeah, I think you've got a small scratch in there. We're going to prescribe some antibiotic drops for you. Take them 3 times a day, and it should clear up.
Okay, thank you.
If you are experiencing a medical emergency, such as severe pain, injury, or illness, where the symptoms seem life-threatening, you will need to go to the hospital. In order to receive treatment, you will have to go to the emergency room, or the ER. And if you cannot get to the hospital on your own, you will need to call 911 and request for an ambulance. These are the following steps you can expect to go through once you arrive at the hospital. Step 1. Rapid medical evaluation. If you've not arrived in an ambulance, you will need to undergo a rapid medical evaluation at the ER. A registered nurse will triage your symptoms, and then a medical screening exam will be done by a licensed medical provider. Patients experiencing the most extreme emergencies will receive immediate treatment.
My chest really hurts. This is the worst pain I've had in my life. I need to go to the hospital.
How can we help you today?
I have this really bad pain in my chest.
On a scale of 1 to 10, how bad is the pain, with 1 being little pain and 10 being the most pain you've had in your life?
It's a 10.
Oh, I'm sorry to hear that. Let's check your vitals so we can determine how we can help you.
Step 2. Registration. The emergency department staff will need to gather information about you before you receive any treatment. You will be asked questions about your medical insurance, your current address, and for an emergency contact.
Do you have insurance?
Yes, I do.
Who is your provider?
Anthem Blue Cross Blue Shield.
Do you have an insurance card? May I see it?
Yes, I do.
Thank you. What is your current address?
100 Smith Street, Connecticut.
Who is your emergency contact?
It's my mother. Her name is blah 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 blah, and her phone number is 100-101-1000.
Step 3. Treatment. You will receive treatment from an attending physician or a mid-level practitioner. Sometimes you may need to have tests done, blood samples taken, x-rays done, or other imaging tests before a physician can see you.
Hello, I'm Dr. Smith, and I'm here to check your heart. We're going to do an EKG to check for the electrical signal from your heart, and this will help us determine what kind of heart condition you might have.
Okay, thank you.
Step 4. Reevaluation. Upon the arrival of your test results, you may need to be reevaluated. After reevaluation, the attending physician will decide whether or not you need to be admitted to the hospital for treatment, or if you can be treated in the ER and then sent home.
Hi, we've got your results back, and it does look like you have a problem with your heart. So we're going to admit you to the hospital, and we're going to take very, very good care of you.
Okay, thank you.
Step 5. Discharge. Once you have been treated, you will receive at-home care instructions to follow for when you are discharged.
I'm glad you're getting better. We're going to send you home. Here are your at-home care instructions. I'm going to give you some medication. You need to take that medication once every day, and then schedule a follow-up appointment for us in about 2 weeks.
Okay. When should I stop taking the medication?
Take the medication until you come back for your follow-up appointment. We'll check you again, and we'll see where we go from there.
Okay, thank you.
You're welcome.
I hope you found these steps of going to the hospital in the US and also going to a walk-in clinic helpful. Bye for now.